All right, here's joint movements from big picture anatomy. At the shoulder joint, we have flexion and extension. Remember, this is always relative to anatomical position, so flexion and extension. We also have abduction, abduction, away from the body, like the shoulder is being, arm is being abducted. Adduction, adduction, adding it back in. Finally, we have medial and lateral rotation. That means the shoulder has 3 different planes of movement, and so it's a ball and socket joint, and we even talk about circumduction, where we can roll the shoulder all the way around like that. The elbow, all we have is flexion and extension. Flexion and extension of the elbow. At the wrist, we have flexion and extension, but we can also do our frontal plane or side-to-side movement, abduction, abduction, and adduction, adduction. The digits, we have flexion of all of the digital joints and extension. And in the joint between the metacarpal bone and the first phalanx, or the metacarpal phalangeal joint, we also have abduction and adduction away from the midline, or the middle digit of the hand. Abduction, away, adduction, adding back in. Now, there's one other move. Oh, the thumb also has flexion and extension, abduction and adduction, giving it that full circumduction of the thumb and allowing for that opposable thumb and fine digital movement that we so often think is a hallmark human capability. We have another one, though, that we don't often think about. Most people aren't even aware of. They think probably that this movement comes from the wrist, and it's this rotation of the forearm. But if you hold your wrist, if you hold the radius and ulna steady, you cannot do any rotation. The rotation comes by a joint between the radius and the ulna, with the radius actually rotating over the ulna, like this. And you can feel that if you put your hand here or put it up here, you'll feel the radius rotate over the ulna. You can even see it happening. And there's a pivot joint between the 2 bones here and a pivot joint here, and they're called the proximal radioulnar joint and the distal radioulnar joint. No common name for these joints, and they allow for this movement. Now, we could just call this lateral, medial, and lateral rotation of the forearm, but it's so special it gets its own name, and we do it in so many different positions that we call it pronation and supination. Some people say they remember supination like I'm asking for a bowl of soup, although it's spelled S-U-P, not S-O-U-P like soup. Or just remember, it's pronation and supination. So just a quick review. We've got flexion of all of the digits, mostly a flexion and extension machine, the upper limb. Flexion and extension of all of the joints, flexion and extension. We have abduction and adduction at the shoulder, at the wrist, and even at the metacarpal phalangeal joints, and then that medial and lateral rotation at the shoulder, medial rotation, lateral rotation, and also pronation and supination of the radioulnar joint. That's the movement of the upper limb from big picture anatomy.